Good evening, it's 5:30 p.m. here in Singapore. I'm Haryanto Diman coming to you live from the Straits Times newsroom. If you're watching us on YouTube, please subscribe to the Straits Times channel if you haven't already done so. The Health Ministry confirmed 611 new COVID-19 cases today, including 3 Singaporeans and permanent residents. Foreign workers living in dormitories continue to form the majority of the remaining cases. Today's count takes Singapore's total to 33,860, and more details will be released later. This is a special edition of The Big Story. Now we're days away from the end of the circuit breaker and transitioning to phase 1 of Singapore's safe reopening, which is expected to last a few weeks. The multi-ministry task force said yesterday that if numbers remain low and stable, the timeline may change and Singapore could see phase 2 starting in end June. Are we ready to transition safely through the 3 phases? What are the possible pitfalls we should look out for as we work towards a new normal? To answer these questions and more, senior health correspondent Salma Khalik speaks with a panel of infectious diseases experts.
Thanks, Haryanto. With me today are a panel of experts, both local and international. Professor Liu Yixin, Executive Director of the National Centre for Infectious Diseases, really needs no introduction, as she is the infectious disease expert leading Singapore's fight against COVID-19, as well as against SARS 17 years ago. Professor David Heymann is an infectious disease epidemiologist at the London School of Hygiene and Tropical Medicine. He led the World Health Organization's fight against SARS in 2003 and has been an international resource on COVID-19. Professor Ying, also an epidemiologist, is Dean of the NUS Swee Hock School of Public Health. Welcome, everyone. Singapore is planning to lift circuit breaker measures in 3 phases starting next week. In the first phase, only about a third of workers can return to their workplaces. Schools reopen, but most retail outlets and restaurants can't. Some people are asking if the government is being too cautious, given the low number of community transmissions. Doing it so slowly over several weeks or even months means a slower economic recovery. So the question to the panel today is, can Singapore safely move faster? Yixin, what is the greatest worry the healthcare sector has about easing measures?
In practical terms, I would think that it's more important for us to anticipate what kind of issues we may face with the reopening of the many of the measures that we're going to put in place. Now, coming back to school, we can't be closing school forever. At some point in time, we have to reopen and we have to reintroduce into our own educational system. So I think it's more important that we anticipate what kind of problem that we may face and have readiness, have a plan to be able to deal with these potential difficulties that we're going to face. So essentially from the healthcare segments that we look at it, it will be important for us to have a mechanism to be able to continue monitoring, to surveillance the issues, as well as having ready solutions that we can step in as quickly as possible. In the end of it, I think the most important thing is that we do progressive opening and we adjust along the way and we find a balance.
When you say anticipate, are you anticipating a surge in cases? I mean, do you have beds ready, people on standby? Is that what you are referring to?
Well, we have to come to a balance. As we reopen and we're going to introduce back many of the services that currently we put on hold. Many patients will require different form of treatments that we have to now bring them back into the healthcare system. So we have to find a balance where we can take care of COVID cases as well as our regular services. And this is something that we can't be doing in a sudden. We have to progressively open, and at every step we must be able to monitor and give us the visibility in terms of how we're going to plan the subsequent steps.
Right, so right now your greatest concern is bringing back people who are non-COVID patients into the healthcare system for the treatments that they need, while making sure that you still have the capacity for the COVID patients. Would that be correct?
Yes, I would say that many of the healthcare services has been ongoing, but there are certain clinical services that we put on hold, and we cannot be putting them on hold forever. We have to bring them back into the care system So moving forward, it is basically a balance that we have to give, and we have to be very clear in terms of the goal that we want to reach. So essentially, we want to give good care to all the patients that require management, whether COVID or non-COVID. And in the end, what we want to see is equitable treatments across, where we can achieve good outcome, reduce morbidity as well as reduce mortality.
Right. So long as the numbers do not overwhelm the healthcare system, and touch wood, it hasn't done so yet, you would not worry unduly.
I don't need to worry. We just need to be prepared.
Right. Just be prepared. Very good. So David, could I ask you to share some international examples of successful lifting of lockdown measures?
Well, thanks, Salma. And you know, the best examples come from Asia, because you've been prepared after the MERS or the SARS corona outbreaks that have occurred in the past years. You've developed the capacity you need in your hospitals to deal with the surge. You've also been able to do contact tracing and isolation of patients, which many countries in the rest of the world abandoned very early. So I would think that the best examples are what's going on in Singapore, in Hong Kong, in Taiwan, in South Korea, and in Vietnam. You've been able to keep the reproductive number low. You've been using these unique circuit breakers instead of just locking down everything at once. You've locked down parts of the economy and then open it up again. And I would agree with what Yi-Sin said, that you can't keep things closed forever. We have to learn to live with this disease while it's with us. And the best way to do that is to begin to cautiously, with the systems of monitoring in place, open up schools, open up businesses, and get on with life, as is happening now in Europe.
Right. Now, David, you mentioned Asian countries. Singapore is only starting to lift its measures next week, so we are a little bit behind some of the others, like Korea, Vietnam. Would you say that their lifting of measures has been a good example for Singapore to follow?
Well, I think Singapore had left certain sectors open at the start of the outbreak and then locked them down and then opened them up again. And this is clearly based on the epidemiology of what's happening. And it makes much more sense epidemiologically than just locking down a whole society without any exit plans, which is what happened in many European countries.
Ying, David, as epidemiologists, where do you see the greatest potential for transmission of the disease with the easing of measures? Would it be at workplaces, schools, or the public transport system, or somewhere else altogether? Ying, what's your take?
Well, I think it really boils down to individual practices, and rather than trying to pigeonhole transmission risk with respect to the different types of activities. Because I think if we look globally at countries and regions that have done immensely well, such as what David has mentioned earlier on, such as South Korea, Hong Kong, or Taiwan. For example, in South Korea, their first wave was really because of that small handful of people going to a place of worship even though they were already ill. And right now, South Korea is trying to contain a growing cluster that started with one club-going person and who was hopping between multiple clubs. So while we try to look at the risk for different activities and try and pigeonhole this risk, the reality is that when people are returning to work on site, children are going to schools, the public taking public transportation, all of this risk, all of these activities can be very low risk if everyone is taking the necessary precautions, or they could be very high risk if people are behaving irresponsibly and not taking personal responsibility. And I think this is where I think it's safe to say that nobody can guarantee that when we ease some of these restrictive measures, that there will not be a resurgence. What we do know based on data, say from Singapore and from the rest of the world, is that the coronavirus spreads the best when people are interacting in fairly close proximity, perhaps over an extended time, be it talking, eating together. And I think this is really the reason why many governments, many sensible governments worldwide, as well as the World Health Organization, issued the same reminders around safe social distancing, to minimize physical interactions, good personal hygiene, and right now, including the advice on mask wearing.
Right, so what you're saying, Ying, is that if everybody behave responsibly, we can actually open up the whole of the economy, the businesses, the schools, the pubs, etc. because it's not the type of activity, but whether people interact for long together. Is that what you're saying?
Well, that is what I'm saying, that people have to bear the responsibility. But equally, we as a system, we need to know, we need to stress test the system. We need to know which are the activities that are most likely to result in an increase in transmission. And that is where we have to look at the balance that Yi-Sin talked about earlier on between hospital capacity to treat and allowing economic activity to return. So by having a phased approach, which is not just Singapore having this phased approach, the United Kingdom similarly has a phased approach, you're able to stress test the system to find out exactly which are the type of activities that after a period, perhaps 2 to 4 weeks of easing, there are no real emergence of new cases, but there could be other activity, perhaps such as nightclubs, that when people come together, it spreads so quickly and you need to reshut that sector again.
Right, thank you, Ying. David, could I turn to you? What do the experts think are areas that are more likely to cause transmissions?
Well, that depends on what the economic and the activity is in the country, the economic activity and whatnot. And what's important is to do a risk assessment in each sector to see where transmission has occurred in the past and where it might be safe to open up first. So a phased in unlocking is very important, as is being done in Singapore and other places, looking at the risk assessment and remembering that underpinning all this must be understanding by the population of how to protect themselves and how to protect others. So in parts of Europe, for example, where they've continued to do contact tracing and identification of all those people who are infected and isolating them, they've been far ahead in opening up. And when they've opened up, they haven't seen a resurgence of cases because they have systems in place to monitor where a disease might be occurring, and they can lock down if necessary. Other countries are just beginning to understand transmission, and they'll be unlocking as time goes on. But I think the risk assessment is very important in this, knowing where to unlock first and making sure that people understand how to protect themselves and others. And that includes in closed spaces, such as the underground in London or various other places where there isn't a possibility to physically distance. Everyone must be wearing a mask properly to protect others. This is very easy in parts of Asia because it's a custom there for many, many years to protect others when one is sick. But this isn't a custom in Europe, and it's something which will have to be adapted as time goes on.
Right. Now, unfortunately, that hasn't been a custom in Singapore, but it's something that we have been learning over the past 2 months. You talk about different sectors. Could we look at schools? Schools will reopen next week, and aside from primary 6 and secondaries 4 and 5, the rest will alternate between home and school-based studies on a weekly basis. Now, since children seem to be the least at risk, is such alternative weeks at school necessary? Yi-Sin, what is the likelihood of a young child getting infected and passing the virus on?
Well, I must say that this is something very new to us. It's a very new virus, and I'm beginning to see some kind of conflicting informations. And I think therefore it is very important for us to have our own mechanisms to be able to monitor our own internal policy and our own internal strategies. I've seen reports mentioning that in fact children don't get very easily infected, and I also seen report that children can be equally infected. Although in the local situations, our local data did indicate that we have lower incidence of children with COVID-19. But nonetheless, I must say that we have to take precautions. We have to learn along the way as we learn how this new virus behave in a different population, different segment of the populations. And do learn in terms of the virus, how it could transmit among children and how that could affect the family. So I do feel that it is important for us to take a stepwise measure. For every step that we take, we learn from it and we adjust along the way till one day we know more about this virus and we know a better coping mechanism.
Right. Ying, could I turn to you? Children may not catch the disease as easily as adults, but in an Asian family, there are very many 2 or 3 generation families. So the risk would be for the grandparents who may be living together. Do you see that as a potential risk for opening schools?
Well, I think that certainly will be a risk because, as Yisin has mentioned, we are still learning about what is the likelihood that children end up becoming the vector, meaning they are the one that carries the disease. They may have a very mild infection themselves, but they end up being the one that spreads the disease to people within the household. So when schools reopen, this is really where we come back to some of the risk assessment that David talked about, that we need to understand using the data that will come about as the schools reopen to really evaluate, is it as safe as we anticipate it to be? Because I think one fact is that low risk does not mean that there is zero risk. And what we have seen so far is that schools are putting in place the necessary measures for the reopening to minimize risk, not just to children, but also equally to the teachers, the staff in the school. And the alternate weeks of on-site studying that Salma, you talk about, it's bad news to some parents, but it is actually a very good way to stress test the system. And this is where you see we are allowing certain, about half the schools to go back first. And I think that parents have to understand the risk right now is actually no greater than the risk that Singapore faced back in the months of February and March when children were still attending classes. And if anything, actually the risk right now will be lower than back then because of all the understanding that the more that we understand the coronavirus, the more measures that we've put in place, including the use of face masks, potentially even face shields coming in.
So you're saying we're actually safer now than we were in March. Any advice to families where they have 3 generations living together? Like you said, when children go home, should they avoid their grandparents or things like that?
We have to learn along our way how we will socially interact with one another, family too. I just want to bring back this point in terms of what we have learned so far from the local epidemiology. We see family clusters. So, and this is one thing that I would like to stress, that we thought that while we interact outside of our home is unsafe. Do think ahead in terms of how we want to interact at home as well, especially at home. You know, we have senior members in our own family.
Right, but you can't expect people to wear masks when they're at home. So what are the sort of precautions that they can take?
Well, the several advices had already came out from the ministry. One is for the senior citizens, first of all, take care of themselves, stay at home most of the time, so reduce the social interactions, reduce the number of social interactions. Essentially, it's basically risk assessment. So in other words, this is a virus that can transmit from human to human. So the less you have in terms of frequency of coming into contact with a huge number of human, you reduce your risk of transmission. I think this is something that we always have to bear in mind. Now, coming back to a family, it is unavoidable that we will come together as a family. Then it's important for us to bring back what would be the risk of transmissions in the family. So if we do have young children that potentially, you know, attending school and the environments may not be safe, despite the fact that they do all the precautions, putting on their face mask, social distancing at school, if there is still a potential risk in that environment coming back to home, then we have to modify our own home environment to be able to reduce the risk. Now, coming back to risk assessment, it is not always to the fact that we can completely eliminate risk. I think that is not possible unless we bubble up ourselves and be the one isolating ourselves completely. And that is not something possible. And therefore, we have to do every steps to engineer into our own daily living how to reduce and minimize the risk.
Right. Thank you very much, Yisin. David, based on international experience, how risky is it to allow all retail outlets, restaurants, bars, etc. to open for business, but with people taking care to mask themselves and have social distancing in place? For example, with restaurants, will it make a difference if people were sitting outside the restaurants instead of inside?
Well, we're learning now as time goes on, and many restaurants in Europe have opened up, but only outside while others are opening up inside with physical distancing between tables. So we'll see what that brings, and I think they'll always be ready to lock down again if necessary. And that's why what Yisen and YY have both said, it's very important that we learn as we go ahead. We've already learned that this disease behaves much differently than influenza. Everybody was prepared for influenza in the rest of the world. Asia was prepared for influenza and also a coronavirus, and that difference shows because you've continued to treat this as discrete outbreaks where you could stop discrete outbreaks, whereas in many European countries, they just locked down the whole sector, stopped doing their contact tracing, and went to pure mitigation, closed down social events, closed down areas where people congregate, closed down businesses, and as a result, they're now beginning to see that they have to exit, and people have to learn to live with this virus.
Right. Ying, could I turn to you? Singapore has been opening up the more critical aspects of society first. So when it does allow for sports to resume, and that might happen in a couple of months' time, are there certain sports that are safer and others that should not be allowed for some time?
Well, I think it is quite clear that sports that involve a higher degree of physical contact and physical interaction, those are likely the sports that we want to defer to later. But there are equally many sports that are more individualistic in nature, and those will be the kind of sports that will be allowed to return in a phased manner. And I think you have heard that all three of us talked about a calibrated and a phased approach towards the easing. And it will have to be the same when it comes to sports, that the same mindset around risk assessment, around testing, around stress testing the system will have to put in place. Because I think one message that came across very clearly from today's discussion is this bit about we are learning as countries unlock what are the measures, what are the activities that will work, that will be allowed with very little risk of resurgence, and which are the activities that will have a very high risk. But I think at this point, it's also important to note that it is not just putting in place systems to prevent or minimize infection completely, because that means that everyone should not just will not interact at all. But it's equally important that we talk about the processes of identifying infections happening quickly and to isolate them. And this applies equally to sports as we apply it to retail sector or schools and workplaces.
Right, so there are some sports like, for example, sailing or kayaking where you're doing it individually, or even tennis and badminton where you're quite far away from your opponent. Those would appear to be safer. But how about swimming? Because swimming is a very popular sport in Singapore and everybody is in the pool together. Do we know whether the virus can live in swimming pools and can it be transmitted that way? Would one of the two doctors like to touch on that?
Well, I'll start. That's a good question, Salma, actually. And to date, there have been no outbreaks associated with swimming pools. So again, we're learning as we go along. We do know that, for example, at a closed choir rehearsal in the state of Washington, where people were all in a closed area for 2 hours practicing, one person was sick and 87% of that group became infected. That's where it was transmitted by droplets from person to person. We just don't understand yet about swimming pools, but we don't believe that this virus is transmitted through water in any way or in a swimming pool.
Right, so we don't know enough, but at the moment it doesn't sound like it's going to be a dangerous sport. Yisen, anything to add to that?
I would echo what David had just mentioned. When we swim, at this point, I would say that this is an RNA enveloped RNA virus, so itself is a fragile virus. So in other words, it's easy to disinfect. So when we talk about swimming, when you're in the water, there is no evidence at this point in time. Water is a vehicle of transmitting the virus. But don't forget, we are not going to be in the swimming pool, in the water all the time. We're going to get up, we're going to go to the toilet. So I would say that for every individual, when you do risk assessment, do think through step by step what would be the potential risk area. So in other words, if you go to the toilet, how do you use the facilities? How's the facilities going to be there? Is it going to be crowded? I think all those are factors that we have to think ahead.
Right, so the swimming itself might not be a problem, but the before and after could be if you don't take sufficient precautions. Could I turn to a different subject, to vaccines? Now, everyone is waiting with bated breath for a vaccine that could spell the end of all these restrictive measures. There are several undergoing phase 1 and 2 human trials. Now, how real is the belief that a vaccine would spell the end of our worries? Ying, as a doctor, what's your take on vaccines and the COVID-19 measures we now have?
I will speak as a doctor as well as an epidemiologist. In our battle against the virus, I would say that if you can have effective, safe vaccine, it will be the best public health intervention strategies that we can put together for mass prevention. But I would say that the journey of having the vaccines become commercially available or widely available for the entire populations to use is still some way away ahead of us. I would also say that at this point in time, the science and the latest technology has helped a lot in terms of the speed that we see in terms of the vaccine development. So certainly we hope that we will see that an effective and safe vaccine will hit the ground very soon. But at the same time, I just want to emphasize again that it will take some time before we see that happen. And in the interim, we have to utilize all the measures that we are familiar with. We know that it worked today, and continue that till one day we truly can have an effective vaccines that we can use.
All this rush to get a vaccine to come out, does that come with dangers? Would the final product be sufficiently good? And more importantly, would it be safe? David, you're also an ID doctor. Could you give me your take on that?
Well, first of all, we're not sure that a vaccine can be developed. We know that other coronaviruses cause immunity, but that immunity is short-lived. Sometimes you can develop a cold with a coronavirus and then 6 months later have a cold with that same coronavirus. So we don't exactly understand the immune response for this coronavirus at present. And hopefully we'll learn that as vaccine research goes on. There are over 100 different efforts to develop a vaccine and many different ways of developing that vaccine. But we shouldn't put all our eggs in one basket. There are also other areas of research. And those areas are looking at the protection that might be offered from antibodies that are produced in survivors, that are in monoclonal antibodies produced in laboratories, and antiviral drugs. So we have other areas of research also that are very important that could impact on the outbreak. But what's most important is to use the tools we have now and make sure that we do the best we can, not waiting for that vaccine, which might not come, or that drug, just getting on with it, living with this virus, and seeing how the virus acts over time. Because remember, we really don't know the destiny of this virus.
Right, so you're saying that a vaccine may not be the answer and we may not be able to get a vaccine. But all the other things that you mentioned are treatments, which means people do get sick, but they may not die of it. But that means a lot of people may need hospital care and they will flood the healthcare system.
That's right. That's a major risk in that they'll need it. But the idea would be to diagnose early and treat early so people don't have to go to the hospital system. And that's a strategy that would be worked out if there is, in fact, a drug or an antibody preparation that's been shown to be able to modify the disease and to prevent it from becoming serious. So early diagnosis and treatment is very important. And that's why the system that Singapore has of identifying early and isolating people who are either contacts and infected or the patients themselves is very important.
Well, actually, you seem to be in a minority right now, because according to most of the news internationally, everybody seems to be going for a vaccine. There are a few drug companies that have pulled out, and they probably think like you do, that it may not be possible to actually develop a good vaccine. But as you mentioned, there are at the moment more than 100 vaccine candidates. If you are lucky, there may be one vaccine that becomes viable. But if that should happen, the question then is, will there be enough for everyone? And who will decide who gets the vaccine? Will it be a matter of who can pay gets it, or will it go to people who need it most? David, you've been with WHO for quite a number of years. Do you see WHO playing a role in vaccine dissemination?
Well, I would hope so. I think WHO has to make sure that there's an equitable distribution of vaccine. And as you know, during the influenza scare with avian influenza, there was actually a framework set up that would include providing vaccine to developing countries, and industry has agreed voluntarily to save 10% of their production to provide to developing countries in some instances. So that's a framework that's been developed for influenza. We'll need to see how we can move ahead with a vaccine once there is, if there is a vaccine, once there is a vaccine, how that can be more equitably distributed. And it's also important to know which populations would be vaccinated. Is the strategy to vaccinate the whole population, or to vaccinate only those populations at greatest risk, which are those with comorbidities and those also of people who are elderly? So a lot to be learned between now and the time when a vaccine is available, if one does become available. And in addition, production capacity is important also, because we can't remove vaccines like measles vaccine or other vaccines from the assembly line, from the fill and finish line, and substitute a new vaccine without having difficulties in those diseases as well. So it's a real complex issue, and WHO must be at the center of solving this.
Right, so if they ramp up the production of a COVID-19 vaccine, then some other vaccines may have to give way to that, and that is not necessarily a good thing. What about the flu vaccine? There are a lot of companies that do that. Would they be able to put aside the flu vaccine for a year and then concentrate on the COVID-19 vaccine? What are the negative impact of something like that?
Well, the flu vaccine will be very important the next flu season in both the northern and southern hemispheres, because that will protect people against the flu and make it easier to diagnose other respiratory infections. If indeed this coronavirus exists or continues, then it would make it easier to diagnose this, because there would be fewer patients presenting with respiratory disease. So flu vaccine is crucial to continue using and increase its use in those risk populations, hospital workers and the elderly, to be sure that if they do become sick, that it's easier to diagnose what's causing it, and if it's coronavirus, they can be isolated properly.
Right. That's quite depressing, because what you're saying is that a vaccine may never appear, and if it does come, if we do develop one, we may not have the capacity to produce enough for everyone who needs it. So we should not, as you say, put all our eggs in one basket, but look at other treatments and other ways to protect people. Tell me, as most countries are easing the lockdown measures, is a second wave of disease inevitable? Would the epidemiologist like to take that?
Well,
I could take that. So I think for certain countries, we are pretty confident that they will experience a second wave of transmission, given what measures that they are taking, or rather the lack of particular measures such as contact tracing, such as very strict protocols around how do they quickly identify, isolate people who have been exposed. So those are the countries that I don't actually have very great confidence that they will avoid a second wave, or I should say they are almost guaranteed that they will experience a second wave. And I think this is really the reason why there are very sensible governments that are putting in place this very slow easing and this stress testing of different sectors, allowing particular sectors to resume in a slow manner, because that is the only way that you can figure out which sector in your particular country is likely to experience a resurgence of infection. And I have to emphasize that because of cultural differences, political differences, fiscal measures differences, different countries will experience different rates of resurgence for the same sector. So what worked in one particular country cannot necessarily be extrapolated to Singapore and so on. So I think there will be countries that will definitely experience a second wave of infection. And we saw from experience with the Spanish flu that the second wave can be much more deadly than the first wave. And I really hope that countries like Singapore, our approach will allow us to experience, even if we do have a second wave, a very small resurgence that our current measures around very aggressive testing, very comprehensive contact tracing will keep a lid on.
Right, so you're saying that our slow approach to easing measures is actually lowering our risk of getting a second wave. And should a second wave happen, can we expect sort of the countries to go into lockdown again, or perhaps more segmented lockdowns of certain areas?
I think that based on our approach, we are very quick to avoid having a comprehensive circuit breaker like what we currently have. And I do anticipate that if we do our easing correctly with the cooperation of the people, with the business sector as well, any lockdown that needs to happen subsequently will be sectorial. And that means that perhaps construction sector, if once people come back and resume activity in the construction sector and we see a spike in infection again, we may be able to just lock down the construction sector while keeping the rest of the economy open. And I do see that our current very careful and phased approach will allow us to be able to perform that risk assessment to find out which are the sectors that are at higher risk and ought to be controlled more tightly sectorially, whereas which are the sectors that can be eased more openly.
Right, thank you very much, Ying. So those of us who are impatient for all these restrictive measures to be lifted need to learn to live with them for a while longer for the safety of everyone. Thank you, David, Yisin, Ying. We need to wrap up the session now, but do keep abreast with the latest on the coronavirus in Singapore and around the world at straitstimes.com. I'm Salma Khalik. Goodbye and stay safe.